The liver is responsible for many important functions, including the secretion of bile juice to aid digestion and the breakdown of toxins caused by alcohol, medications, and metabolism. A healthy liver is critical to our overall health. If you're feeling tired, have problems with your digestion, or experience jaundice, you may have a fatty liver. Fatty liver is a condition in which your liver becomes fatty and enlarged. It can be caused by a variety of factors, including an unhealthy diet and excessive drinking. There are many ways to treat fatty liver naturally, and you don't have to endure pain. In today's video, we will talk about ways to treat fatty liver naturally. Before we continue, if you haven't subscribed to our channel yet, be sure to do so and turn on the bell icon. Lifestyle change also plays a big role in treating fatty liver. Here are 7 ways to treat fatty liver naturally. Number 1. Maintain a healthy diet. One of the key ways to treat a fatty liver is to eat a healthy diet. Make sure to include plenty of fruits and vegetables, whole grains, and low-fat dairy products. Avoid sugary drinks, processed foods, and fatty meats. You can improve your health and heal your liver by eating a healthy diet, which guarantees you're getting the nutrients you need. Additionally, it aids in weight loss if necessary and helps you avoid foods high in sugar that may cause fatty liver. Make fresh vegetables up to 50% of your meals, lean protein up to 40%, and complex carbohydrates up to 40% of your plates. Snack on low-fat dairy, fruits, and vegetables. Chicken, turkey, fish, tofu, nuts, beans, meat substitutes, and low-fat dairy products are examples of lean proteins. Starchy vegetables and whole grains are examples of complex carbs. Number 2. Stay away from alcohol. The link between alcohol and liver disease is well documented. While heavy drinking is responsible for the majority of liver damage, even modest consumption of alcohol can lead to a fatty liver. When the liver becomes overloaded with fat, it can become unable to function properly, leading to a slew of health problems. Drinking too much alcohol can damage your liver and lead to fatty liver. Alcohol is digested by your liver, so drinking can hinder the liver's ability to recover. It might sometimes make your condition worse. When trying to treat your fatty liver, stay away from alcohol. If you like to drink, you might ask your doctor if it's okay to consume a serving of alcohol once in a while. You might have to give up drinking though. If you're having trouble quitting, consider attending a support group. Number 3. Avoid eating much sugar. If you're like most people, you probably enjoy sweets and snacks from time to time. However, too much sugar can lead to some serious health problems. One of the most common ways that sugar harms your health is by damaging your liver. Over time, excessive sugar consumption can cause your liver to become fatty and inflamed. Foods high in sugar also tend to be high in calories and unhealthy fats. This combination can lead to weight gain, obesity, and other health problems. Fortunately, there are many ways to reduce your intake of sugar. You can try to cut down on your sugar intake from all sources, or focus on reducing your sugar intake from unhealthy foods. A high sugar diet causes you to gain extra body fat, which your liver may retain. Eliminate added sugars from your diet and keep an eye on how much natural sugar you consume to avoid your illness from getting worse. For instance, limit your intake of sweets and avoid adding sugar to your beverages. You should keep track of how much fruit you consume since too much natural sugar still poses a risk. Number 4. Drink 2 to 3 cups of coffee daily. Coffee is a powerful antioxidant and has been shown to improve liver function. In a study of over 51,000 participants, those who drank coffee had a 30% lower risk of developing liver cirrhosis. Furthermore, coffee has been shown to improve overall liver health and protect against other chronic diseases such as heart disease. Coffee could preserve your liver from inflammation-related damage. But not everyone will have the same results, and it's unclear why coffee works for some people with fatty livers. If you like coffee, consume 2 to 3 cups per day to promote the health of your liver. This can make you feel better about your everyday coffee habit if you currently drink it. Don't begin consuming coffee only for this reason though. You don't know how the caffeine will make you feel, and there's a chance that the coffee won't even have any advantages. Before we proceed, if you're enjoying this video so far, be sure to like the video and subscribe to our channel for more videos. Number 5. Exercise regularly. Regular exercise can also help to reduce the risk of developing fatty liver. Exercise can help to reduce inflammation and improve your overall health. You can lose weight and increase your level of fitness by engaging in moderate exercise. To make it easier for you to exercise every day, pick an activity you enjoy. However, make sure you're in good enough health to exercise by consulting your doctor first. You could, for instance, take long walks, enroll in a dance class, attend water aerobics, swim, practice yoga, or join a recreational sports team. Number 6. Take supplements. If you don't feel like you're getting the optimal benefit from diet and exercise, consider taking supplements. Some natural supplements that have been shown to help treat fatty liver include choline, CoQ10, and omega-3 fatty acids. Vitamin E. Antioxidant-rich vitamin E may lessen the inflammation in your body that's causing your fatty liver disease. Though it doesn't work the same for everyone, it might aid at the beginning of your liver's recovery. Garlic supplements. Take a supplement instead of cooking with garlic if you prefer. This will improve your lipid profile, insulin resistance, and liver stress all at the same time. Resveratrol supplement. Your liver will experience less stress and swelling thanks to resveratrol. While its properties might help prevent further harm, they usually won't aid in liver healing. Number 7. See the doctor. Though your fatty liver disease may worsen, try not to worry. If this occurs, talk to your doctor to ensure you're receiving the care required to treat your condition. If you experience any of these symptoms like bleeding, weight loss, weakness, fatigue, fluid retention, and loss of appetite, all of which indicate that your fatty liver disease is getting worse, see a doctor right away. If you have any persistent symptoms or if your liver tests are abnormal, a doctor can recommend the best treatment for you. Adapting to this kind of lifestyle might not be easy if you are trying to prevent fatty liver. Let us know how it has been possible for you in the comment box below. Enjoyed this video? Make sure to hit the like button and subscribe to the channel for more videos. As always, we'll see you soon with more videos covering health and wellness topics. Thanks for watching.